Hey everyone, welcome back to the NPTE podcast. This is Will Crane, your host. Thank you so much for joining me as we go through the content you need in order to dominate on test day. So today I've got a practice question related to the musculoskeletal system. We've got an MSK examination question for you. Just a reminder as we go through this series or go through the podcast, we're going through the FSBPT's content outline. Now, as you know, the FSBPT content outline had a small update recently. And so what you'll see is that as we go through the content, those of you watching the video, you'll be able to see the number of questions represented in each of the sections on the NPTE. Now, the change from 2023 to 2024 is relatively small in the proportion of questions. Still, most of the questions come from cardio, and neuro. They did reduce the overall number of questions simply because they introduced the scenario-based items, meaning that you answer a scenario or you look at a scenario or essentially a patient chart and then refer back to that to answer several questions. Now, the questions are not cumulative in the sense that you don't have to answer question 1 right in order to get question 2 right. Rather, they are, in a sense, standalone, but they require you to reference or go back to the patient scenario. So those are a little bit more difficult to do on the podcast. We certainly are doing tons of those in our live classes, simply because, as you'd imagine, in a podcast format, it is somewhat difficult for you to refer back to the scenario in order to answer multiple questions. So we'll probably continue to focus on primarily our what we would call standalone questions in the podcast. The point being that it's imperative for you as the studier to be able to analyze, evaluate a patient chart, and then answer multiple questions on that. So for those scenario items, these are ones that I recommend you read backwards in the sense that you look at the question and the answer options before then referring back to the patient chart. Again, it gives you some focus. So you're able to more narrowly observe and see items in the scenario that would be relevant to the question you are trying to answer. So for instance, if it's a modalities question, you would then refer back to the patient case and look for things that would be relevant to the parameters, the indications, the contraindications, all of that would be relevant to the modalities. So anyway, with that, today I've got a musculoskeletal question. We've started back up onto the most highly represented section on the exam, which is the musculoskeletal section. For the 2024 exams and beyond, you can expect somewhere between 44 and 54 questions related to this. So a very robust section. But before we get to that, just a quick reminder, if you haven't yet, it's not too late if you'd like to sign up for our VIP class. So the VIP class, I run this every quarter. It really is the most robust course that we run. It's the one that I personally take students through. We go through every system on the exam. We spend time going over tons and tons of practice questions in our live classes, in addition to a full video library going through tons of content that is relevant not just to your practice, but also to the questions you are likely to encounter on test day. And that's one of the advantages I have of doing this for many years now, is that there are loads and loads and loads of questions, but there are themes that very frequently show up again and again on test day. So I'd encourage you, if you're looking for a very robust study plan, you'll want to jump into that VIP program. Plus, you also want to check out all the other courses and offerings we have over at ptfinalexam.com. We have university cohorts. If you're a part of your university, we can come on campus and then also include some of our synchronous and asynchronous content. You can check it all out at ptfinalexam.com. All right, let's go ahead and dive into our practice question today. So as per our usual, I will read to you the question, give you a moment to respond, and then we'll talk about the answer together. Here we go. Which of the following descriptions best correlates with a positive pivot shift test in a patient with ACL deficiency? So which of the following descriptions best correlates with a positive pivot shift test in a patient with anterior cruciate ligament instability, or ACL deficiency, I should say? So which of the following descriptions best correlates with a positive pivot shift test in a patient with ACL deficiency? Number 1, posterior tibial displacement while in knee flexion. 2, posterior tibial displacement while in knee extension. 3, tibial plateau subluxation in 90 degrees knee flexion. And 4, tibial plateau subluxation in 10 degrees knee flexion. So we've got posterior tibial displacement either in knee flexion or extension, or tibial plateau subluxation in 90 degrees knee flexion, or tibial plateau subluxation in 10 degrees knee flexion. So again, posterior tibial displacement with knee flexion or extension, or tibial plateau subluxation in 90 degrees flexion or 10 degrees flexion. So the correct answer here, when we talk about the pivot shift test, this is a rotary instability or anterior rotary instability, or anterolateral ligamentous instability test, testing for anterolateral instability. So when we talk about the pivot shift test, we're talking about where you start in an almost or near extended position. Now, the reason you don't start in full extension is because of what's called the screw home mechanism. That's because of the shape of the femoral condyles. It pushes you into slight external rotation. So you pop out of that just a little bit. So you begin the pivot shift test. You grasp the bottom side of the patient's foot and immediately rotate the tibia. And you start in this almost extended position or slightly flexed position at 10 degrees flexion. And in that position, you get a displacement or tibial plateau. What is it? The anterior subluxation of the tibial plateau. Remember, as you're medially rotating the tibia, you're causing a lateral tibial plateau anterior subluxation. That's a mouthful. So in a sense, you are subluxing the tibia in the slightly flexed position. Then as you move into full knee flexion, so about 40 degrees and beyond, you will find that the femoral condyles grab it back and reduce the tibiofemoral joint, or the knee joint. You get a reduction or a palpable reduction. And that's what you look for with a positive pivot shift test, is that as you move into knee flexion, it pops back or reduces. And then as you move back towards extension, it subluxes again. So again, with the pivot shift test, you start in an extended position. And as you go into flexion, it goes from subluxation to reduction, back to subluxation as you extend or move back to a neutral position. So again, just to say it again, when we talk about the pivot shift test, you begin the test with the knee in slight flexion, so about 10 degrees flexion. And at that point, it begins in a subluxed or dislocated position. You move into knee flexion, which reduces it. So you hear a palpable pop or a shift or a clunk. And then as you move back into knee extension, it subluxes again. So it goes subluxation, reduction, subluxation. So these other two options, the posterior tibial displacement, this would be most likely to be observed in, say, a case of a posterior sag sign. So a positive posterior sag sign. This is where you support the distal lower leg, meaning the ankle. So you have some support under the lower leg. You perform this in knee flexion, and you observe to see if there is a posterior shift of the tibial tuberosity. So you're looking at the lateral view of the tibia. And so if it were to shift posteriorly, if the tibia were to, in a sense, sublux posteriorly, that would be an indicator of a PCL deficiency. However, in this question, we're asking about an ACL deficiency and a positive pivot shift test, which would therefore result in tibial plateau subluxation in about 10 degrees of knee flexion, with reduction occurring at about 90 degrees of knee flexion. So there you go. That's the pivot shift test. Again, it goes from subluxation to reduction to subluxation as you go from extension to flexion to extension again. And it's a test of anterolateral rotary instability related to ACL deficiency. All right, so with that, we'll bring this session to a conclusion. Be sure to check out all the other episodes we've got as we go through tons of practice questions. If you haven't yet, be sure to leave us a like, subscribe, give us a 5-star review. That always helps. We're trying to get the word out about the NPTE podcast. And in the meantime, thanks for all the hard work you put into this. I know that as you study, it is a difficult process. I know there's a lot going on. And I just want to say I appreciate the efforts you put into this. So hang in there. Keep a grin on your chin as you study. And I'll catch you all in the next episode. Will Crane fist pumps all around. Thanks.